So let's talk about what we're going to discuss today is anti-aging, and we know that there's a big push for this. There's so many products and processes out there that say, oh, this will help you with wrinkles or help you keeping and looking younger. So kind of explain that first off, why this hype around this, of course, and then ways that we can actually prevent aging.
I think sort of one of the new trends is probably less is more. I think the overdone, operated on look, kind of your classic Joan Rivers, maybe Dolly Parton's getting there. Those sort of
Michael, do you have any photos for that?
Yeah, pulled tight as a drum faces are getting a little bit out of vogue. And one of the more interesting things that's occurring in facial beauty is we used to have sort of a simple two-dimensional view of facial aging that was all just drooping. And so we spent decades as surgeons developing procedures that lifted and tightened, and then we get these sort of unnaturally pulled tight looking faces.
Very much so. That is true.
So now we're realizing that a youthful face, your face perhaps, Chelsea, a youthful face has more fullness, and an older face has less volume. So we're getting a little bit more away from just pulling tight and trying to revolumize faces. We can do that in the office, we can do that in the operating room. There's different ways to add volume to faces, but round cheeks, fuller faces are more signs of youth. They look more natural, and you don't have that pulled, over-operated look.
Oh, that makes me feel better, because I don't really have cheekbones. I'm more round. So I'm younger, right?
That's right. Round is youth.
Just kidding. I wish I had higher cheekbones, but no. But yeah, that's really interesting, actually, to kind of see how that's developed. So, what are some simple things people could do too? We know, using sunscreen is a big deal. Yeah,
one of my sort of guiding philosophies, let's do creams before needles, let's do needles before scalpels. So the first thing I want to do when I meet a new patient is make sure they're doing good basic skin care. We live in one of the greatest states in the nation, lots of fun outdoor activities, bright sun.
You always want to be outside.
Most months of the year, so everyone hopefully watches
this right now.
Well, even in
the winter,
exactly.
You get so much sun up on the slopes skiing, and so there's so much.
There's actually published studies in dermatology journals that say that the reflective sun off of snow is equivalent to being on the beach of a major tropical resort.
Really?
So there's a lot of intensity from the sun here in Park City.
Wow, I didn't know it was that much the same.
Always preaching sunscreen, sunscreen, sunscreen. Everyone should be wearing sunscreen, a daily sunscreen. People who think, oh, I don't go out in the sun. But you still walk out to your mailbox, you run out to your car, you chase after your kids. Those small exposures over a lifetime can lead to skin cancer. So sunscreen is number one. After that, you...
Oh, sorry, I had a question with that. Well,
Please.
I know that, like with my own morning regimen with washing my face, a lot of products have 15 SPF. Is 15 enough, or do you need 45?
I think if you're just going to cover that occasional out in the sun, 15 is probably just fine for a daily
that's just
use.
Daily.
Exactly.
So that's something that would work.
And you don't, as you get into the higher sunscreens, they're going to feel more cakey. If you're not going to be out in the sun sunbathing, then a 15 is probably completely adequate. If you're going to be out in the summer or out in the slopes for the day, then we want you to use something heavier. But 15 is very appropriate for just day-to-day use.
Good to know. So sorry, go on.
Well, then after your sunscreen, that's sort of the basics. Then you want to see what people are doing to sort of minimize fine lines and wrinkles. And there's more and more prescription medications which are pretty good for that. It's interesting if you watch TV commercials, all of these commercials for anti-wrinkling makeups, and really there's very little science behind them. The most science is behind...
What, they're lying to us? I had no idea.
Imagine that. There's mistruths on TV.
Gosh.
Well, the FDA doesn't regulate makeups, and so they're allowed to make larger, more boisterous claims.
Okay.
Now, the FDA does regulate prescription medications, and so if a prescription medication is going to say this helps with wrinkles, they have to have done controlled clinical studies to prove that. So some of the Retin-A products that have been out for years and years are great for fine lines and wrinkles, particularly in the eyes, forehead, mouth. Renova is more of a prescription-based anti-wrinkling medication. Those are some of the easier medications to begin on that are going to not make you look younger next week, but if you use them day after day, week after week, you'll begin to notice that you're losing fine lines and wrinkles and probably looking a little bit younger than people around you the same age.
And when it comes to products, I asked you this beforehand, but new skin? What do you have to say about them? Because their big push is anti-aging products.
There's a lot of grade of these sort of these pharmaceutical grade cosmetics. New Skin's one. In our office we carry PCA, Physician's Choice. That's another popular one. Obasi's almost become a household name. I don't think you could scientifically say that one's better than the other. Probably the most important thing, find one that you like, find one that feels good on your skin, and stick with it. But they all do similar things. No one can come out and say, we are the best, because that study probably couldn't be done and scientifically valid.